Dr. William Schaffner joins us from Vanderbilt University. Dr. Schaffner, so many questions here. The effectiveness of these two experimental medicines seems like an awfully ginormous breakthrough here, if you will. Explain to us why this is such a big deal.
It is a big deal because until this time, we've been able to provide supportive care for Ebola patients while their bodies fight the infection by themselves. But now we have therapies that can actually help the body attack the virus itself and prevent the illness from getting worse. That, along with the vaccines that we are using in order to try to prevent the Ebola infection in the first place, are a nice 1-2 punch, and I hope will help bring this outbreak to a close.
Do these treatments work differently when it comes to prevention versus perhaps treatment?
Well, the vaccines we have prevent. So you get those vaccines before you become sick, and they prevent you from becoming sick. Now, if you do get sick and you have to go to the hospital, we now have better treatments to make you better faster. You're more likely to survive. And this will add to the reassurance that we can give the populace that it's worthwhile sending their patients who do get sick to the hospital. You want to get them out of the home, because if they remain in the home, that's where the disease, the Ebola, can spread to other family members.
As far as you know, are there any serious side effects to these two new experimental drugs?
Both of them seem to be very, very safe. Of course, it's in the context of treating a very fatal infection. But so far, no major adverse effects.
What does it mean in terms of curing the disease, even eradicating Ebola for good, Dr. Schaffner? Maybe not now, but one day in the future?
Well, that's way down the road. You know, Ebola is out there in the population of bats in wildlife. So I don't think we'll be able to eradicate this disease, but we ought to be able to use both the vaccine to prevent it, and then if you do get sick, these new treatments to make you better more quickly.
More than 1,800 people have died in the DRC during the past year because of this outbreak. Do you think the number of fatalities would have been that high if this outbreak, and again, this is just, I'm throwing it out there, if it had happened in a major Western city?
Well, actually, we can provide extraordinary supportive care locally if the situation is calm, but of course it's been a socially turbulent circumstances have been there, hazardous, so we haven't been able to provide optimal medical care. But these new medicines, I think, can help tip the balance in favor of survival.
You know, one of the reasons containing Ebola has proved very difficult in the DRC is because of violence by militia groups, as well as suspicion, Dr. Schaffner, and mistrust towards foreign medical professionals. Do you think the success of these trial drugs could perhaps change that?
Definitely. It will add to the confidence that the population has that taking the patient and bringing them to the hospital is good for the patient. And that will add confidence in the people who are there trying to treat and prevent Ebola.
Is it true that the first Ebola outbreak was actually in 1976? And if that is the case, are you surprised it has taken this long to come up with an effective medicine?
Well, that was the first recognized outbreak by modern science. I'm sure that there were outbreaks previous that had never been determined. However, it's taken science this long. Remember, there are many viral infections for which we still don't have treatments. So there's been an awful lot of scientific work that's gone into trying to provide, as I say, vaccines that work, and now treatments that will help make you better.
Dr. William Schaffner, thank you so much.